we're talking about obesity, or in other short words, overweight. So, as the weight increases or more food consumed, more than excess required, leads to increased obesity. Something called calorie excess, we see in these two pictures, and a calorie deficit. We see a thin person. This is calorie deficit. Now, appetite plays a huge role. A lean person having excess calories with huge appetite can lead to an obese person. This is more obesity. Another factors of having obesity is insufficient exercise. Now, exercise plays a huge role. Having more food and less exercise can lead to an obesity. Individuals shape eating for what they want or possibly what they have to eat during leisure times. Now, the diagnosis and treatment is quite varied from the types of obesity. Let's talk about the complications of obesity or disadvantages. What we see in this picture is called coronary heart diseases. This is one of the main causes. Atherosclerosis is one of the main causes. Increased hypertension is also another cause. Then, what are the other causes? Gallstone formation is more also seen. Is one other seen because of, as we know, hyperlipidemia. Second is increase in uric acid levels leads to gout formation. You can see in these pictures. So this is how what are the main disadvantages. So any metabolic disorders is ensured to check for gout or increased uric acid, increased lipids, and heart conditions. ECG is important. Now let's check out the causes and effects. So when you talk about diabetes, type 2 is most common. You see in obesity. Now as obesity increases, number of fold increases. Now if it's more than 50% of body weight, increase by 25% of diabetic patient. So how do we cure this? First, one should reduce fat as much as possible. Common thing. Remember this, and it's a fun fact. 1 gram of fat equals 9 calories. Second, avoid using food items in fat. Could be red meat, organ meat, or whole milk elk. So reduce this. Second, limit use of sugar. This is very important. In this day and age, sugar should be reduced, because if sugar is not metabolized, it is stored as fat. Second, consumption of alcohol leads to increased lipid formation, leads to fat. Remember, this is corresponding to increase in triglycerides formation. Then, this are our main points. Let us revise. Talk about obesity. It's overweight, increase in weight. This is quite important line. Calorie excess, calorie deficient, insufficient exercise, coronary heart diseases, gallstone formation, uric acid. You can see this. How type 2 diabetes is most common. First you do is reduce the fat, avoid fatty food items, sugar is a big no, so remember that. And now alcohol is also a big no, it leads to a triglyceride formation. Thank you for today's class. Let's continue for more.